Heart failure is a common chronic disease and one of the leading cases of hospital admissions and readmissions. 1 in 5 adults who leave the hospital will return in 30 days. More than 6 million people in the United States have heart failure. Sometimes understanding and managing your heart failure can be difficult. We know from experience that taking the right steps can guide you to better health. We've launched the Johns Hopkins Congestive Heart Failure Hospital-to-Home Transition Program, which consists of 3 major components: the Nurse Transition Guide, the Heart Failure Bridge Clinic, and remote patient monitoring. We want to improve your care transition after you're discharged from the hospital, whether you're going back to your home, to a skilled nursing facility, or a rehab facility. We, your healthcare team, will customize a transition plan especially for you. Let's get to know your healthcare team and how they can help you navigate your journey to better health. Meet one of the nurse transition guides with the Johns Hopkins Home Care Group. Think of her as your heart failure coach, advocate, teacher, and most importantly, your guide to a healthy hospital-to-home transition. Once you're discharged from the hospital, your nurse transition guide will call you within 48 hours or 2 business days. Together with your transition guide, you'll review your discharge instructions to be sure that you understand what medications you need to take and what your medical team told you to do to care for yourself after leaving the hospital, have follow-up appointments scheduled with the Heart Failure Bridge Clinic or other providers, and know who to call if you feel worse or if you have questions about your medical care. You and your nurse transition guide will also discuss your goals for learning to regulate your condition, how you can manage your care at home, and the changes you would like to work on first. Nurse transition guides will help you identify your goals and match you with the appropriate resources in developing a plan based on your needs. And the nurse transition guides services are available for 90 days at no cost to you. There's an entire team of caregivers at the Heart Failure Bridge Clinic dedicated to helping you manage your condition, prevent hospital readmissions, and avoid emergency room visits. Through weekly telephone, virtual, or in-person visits, this multidisciplinary team will provide you with quality heart failure care and guide you through a safe transition from the hospital to your home. Let's go a bit further and learn about each team member: cardiologists, nurse practitioners, nurses, a pharmacist, a community health worker, a social worker, and an exercise physiologist, and learn about the roles they play in your healthcare. There's a cardiologist in the Johns Hopkins Medicine Division of Cardiology. She's one of several cardiologists who may participate in your care. We also have nurse practitioners at the clinic who will help you understand your heart failure diagnosis and facilitate a smooth transition from hospital discharge to home. They will work with you to optimize heart failure care by adjusting medications, ordering diagnostic testing, and provide IV medications to help manage your fluid status. The nurse practitioners work closely with heart failure specialized cardiologists to manage your heart failure and make sure you're connected to a cardiologist. The nurses at the clinic will provide educational information and customized counseling for each individual patient. The pharmacist will meet with you to review all medications and make sure you understand what each one is for, as well as what to expect from each medication. They will also work with your team to optimize your medicine regimen so you can get the most benefit from the medicines you take for heart failure. You'll also be introduced to a community health worker who will connect you to community resources such as transportation, housing services, social services agencies, and food delivery services. We also have social workers who can help link you to social supports to address financial issues, legal issues, health insurance coverage, and prescription assistance plans. If needed, they also provide counseling to help patients and families deal with emotional stress, anxiety, and depression. And last but not least, the exercise physiologist at the clinic will evaluate your heart function and work on personalized plans for physical activity and help implement other lifestyle changes that can help improve your daily life. The third component of this program is remote patient monitoring, also known as RPM, which is part of Johns Hopkins Home Care Group. The program provides you with tools to assist with monitoring your health status, education about your disease every day, and disease management nurses to oversee your progress. RPM allows us to track your health on a daily basis, and it's a great way to communicate critical information about your heart's activities and symptoms to your healthcare provider. It works by sending your blood pressure, weight, and symptom reports to the disease management team using a transmitter connected to the monitoring device. The process only takes about 5 minutes every day. RPM allows your doctor to learn more about your heart's response to medicines and activity and decide what actions, if any, to take. With extra support, your healthcare team can intervene more quickly, often before you start to feel bad, when your symptoms or status worsen. Together with this technology and the disease management team, we can often reduce the number of follow-up clinic visits or trips to the emergency room. Another important resource that the Nurse Transition Guides will review with you is the Heart Failure Zone tool, which provides a plan on how to manage your care based on where your symptoms fall within 3 zones. The tool is very easy to use, and when combined with remote patient monitoring, will help you monitor symptoms and weight gain, a common indicator of heart failure complications. Within the hospital-to-home transition program, we have many available tools and healthcare providers to help you manage your chronic heart condition. We want you to know that we, your healthcare team, are here for you. Our goal is to improve your health and to help you avoid readmissions to the hospitals or returns to the emergency room. We're dedicated to customizing your care to meet your specific needs. By working with your Nurse Transition Guide and using remote patient monitoring, available for up to 90 days at no cost to you, plus the team at the Heart Failure Bridge Clinic, we will help you get back on your feet. Remember, you're not alone, and we'll be your guides along your journey to better health. We're looking forward to working with you, and a Nurse Transition Guide will be in touch with you personally in a day or 2.